My name is Dr. Mazhar. I'm assistant professor in K.R. Mangalam University, and in this topic we are discussing about the toxicokinetic and their role in human health. The lecture is divided into the introduction to the toxicokinetics and their role to study about the toxins. The toxin is distributed in the body where there is a high role of lipids. They are mostly stored in the fatty tissues like fat tissues, liver, kidneys, bone, and the most common storage depots. It is migrated, it is transported through the blood. Thus, blood serves as the main avenue for the distributions as a or the main transporter for the distributions of a chemical oblique the toxins in the body. Lymph also distributes some materials in the body, but this is limited to certain drugs. Next is the metabolism of a toxins. Metabolisms or also known as a biotransformation is a major factor in determining the toxicity. The products of metabolism are known as a metabolites. Metabolites there are two types of metabolism. First is detoxifications and second is bioactivations. Detoxifications, certain drugs we use in our body for the treatment, since for common cold, for fever, for analgesics, for certain disorders, sometimes for infections. Throughout the years, we are taking some medications. So, what our liver is the main metabolism organ. It is detoxifying the certain drugs, and after detoxifying, it is entry into our systemic circulations, and this mechanism is known as a liver metabolism. When there is a detoxification by the liver, the toxicity of the product is toxicity of the molecule is reduced. Second is the product we are having through the various routes, but this is not activated so that it cannot give any benefit to us. What will we do? The nature has given the liver is responsible for the bioactivation of certain molecules. For dopamine, let's take an example of dopamine is converted into a levodopa by the liver, and the levodopa is then absorbed by the is then reached to the systemic circulations. The detoxification is the process by which a xenobiotic is converted to the less toxic form. Now, a new term is convert is a xenobiotic. Xenobiotic is any agent that is toxic to the human health or any organism. This is the natural defense mechanism of the organism. Generally, a detoxification process converts the lipid soluble compounds to polar compounds. Bioactivations is the process by which a xenobiotic may be converted to the more reactive for or toxic forms. Last, after the metabolism, the drug or toxin will show effect. They will try to excrete, they will try to eliminate from the body. The site and the rate of excretion is another major factor affecting the toxicity of a substance. The kidney is the primary excretory organ, followed by the gastrointestinal tract and the lungs for the gases. Substances and metabolite may also be excreted in sweat, tears, and milk. As a large volume of blood serum is filtered through the kidney, nearly 180 liters per day. Lipid soluble toxicants are reabsorbed and concentrated in the kidney cells. Let's take an example of mercury. Mercury, after the injections of the mercury through the skin whitening creams, they cumulatively deposit into the nephrons, and after certain times it may cause the nephrotoxicity and neurotoxicity in certain populations, and it is very toxic for the special population, for pediatric populations, for geriatric populations, for pregnant ladies. The mercury is very toxic as it comes under the category of heavy metals. It may cause kidney side effects, kidney effects, or impair the kidney function, causes slower elimination of toxicants and increase their toxic potential. That's why always doctors ask for three major tests. First is CBC, complete blood count, LFT, liver function test, and the last is KFT, kidney function test. If there is a D range of any chemical entity of any chemical molecule, it will reflect into your CBC, KFT or LFT. That is why these are important parameter in deciding the health of an individual. Toxicokinetic may thus be different from the pharmacokinetic from a technological perspective in many ways, as solubility and stability. In view of the very high doses used in toxicokinetic, one can readily encounter the solubility problems. Higher the dose can be soluble in number of solutions. These may occur during the dosage form preparations and administrations, and also in terms of drug solubility in the gastrointestinal tract. Now, the solubility is important in toxins and comparing to the drug. When there is a less solubility of the drug, so we have a different routes, different methods, we can increase the solubility of a drug molecule of a chemical entity for the treatment. But in this case, we cannot increase the solubility of the toxins or toxicants. The more seriously, perhaps this could give rise to the drug precipitations in biological fluids and in organs and tissues, giving rise to toxicity that may not be associated with the intrinsic pharmacological or toxicological effects of the drug. We made some nanoformulations, nanosuspensions, some tablets using some methods so that we increase the solubility. But after entering the body, they reach to their original form and they are depositing into our body. And it is also with the passage of years, with the passage of treatment, as the treatment is increasing, they are depositing in cumulative frequency in the body and may cause some toxicity. The toxicokinetic applications. Principles to design, conduct and interpretation of drug safety evaluation studies and in validating the dose related exposure in animals is essential. Toxicokinetic data aids in the interpretations of toxicological findings in animals and extrapolations of the result data to humans. It means we are injecting high doses of toxins to the animals. We are performing serum analysis, we are performing liver analysis, histopathological studies of liver, kidneys, brains and every cells, spleen, whatever the organs are available in the rats or animals, we are performing the histological and biochemicals. Normally we use three kinds of data. First is blood data, the CBC, LFT, KFT data of the animals. Second is the histopathological data using the slides of the liver, brain, spleen, pancreas, whatever the target organs is used. We use every organ for toxicological evaluation. Last is the radiological examinations. Radiological examinations in when the animals is exposed to some radiation. So these three categories are used for the evaluations. That's why the toxicokinetic is a useful application for toxical studies and especially for preclinical studies. Toxicokinetic studies are performed in animals during the preclinical drug development and may continue after the drug has been tested in the clinical trials. Several drugs are passed from the clinical trials within 3 years, 4 years, but when the drugs is in the market is used for 50 years, 100 years and some patients are on a daily basis are using drugs. For example, for the management of diabetes and hypertension, the patient is dependent on medication for a number of years, 10 years, 15 years. It is only a cure, not a treatment. That's why so when a single drug is giving to a patient for a longer time, it may cause some toxicity. So that's why we need a longer durations for toxicokinetic studies than the clinical trials. The toxicokinetic, the fate of toxins in the organism. Basically absorptions, transport, distributions, transformations and excretions, big interspecies and individual differences. Routes of absorptions, GIT, the gastrointestinal, influenced by the pH, microflora. These are the factors affecting the toxicity. The respiratory apparatus, skin and external mucous membranes, parenterally either given the subcutaneously, intramuscularly or the IV. When a drug is given to the IV, it is 100% bioavailable in the uh, human body or the animals, or an injections of snake venom or some other zootoxins. Other routes of excretions may consider the kidney is a primary routes of excretions, liver, gastrointestinal, lungs, mammary glands, salivary glands, sweat, lacrimal and sebaceous glands and their products. Some is enterohepatic cycle. This is a new term, enterohepatic cycle. The body tries to excrete the substances or their metabolites via the bile. Bile, this is also used for the digestions of the fat molecules in the body. But due to their lipophilic nature, once they are in the intestine, they reabsorb back to the blood, which makes them hard to excrete. That's why the gallbladder is responsible for excretion some kind of toxic. When there is a excretions of drug through the bile, this process is known as enterohepatic cycle. Now, while using the animals, there are certain limitations. We are harming the animals. We are giving the pain to the animals. To avoid these methods, we use some alternative methods to the animal toxicity testing. Now, of the animals, models have been used to develop the human biochemistry, physiology, pharmacology, endocrinology, and toxicity. Every year, 10 to 100 million animals are used for the testing. It's a huge number, 10 to 100 million animals. It includes a number of varieties, species, mice, rat, genetically modified species, monkeys, rabbits. A number of animals are used and they are sacrificed. The animals use experimentations distributed among the zebrafish to primates. A vast majority of animals are sacrificed at the end of the research program to get the end results. That's why the some kind of pain and we are harming to our environment. For this, we have alternative methods of animal experimentations. For that, for avoiding the animal experimentation, we can divide these animal experimentations. We can use some methods, novel approach to use the alternative method. First is minor animal suffering. Observing animals in behavioral studies, single blood sampling, immunizations without adjuvant, etc. These are the some techniques we can give the very less suffering to the animals. Second is moderate animal suffering. The repeated blood sampling, recovery from general anesthesia. While giving a pain to the animals, we can administer some anesthesia. So there is a we can subsidize some pain. Severe animal suffering, LD 50 dose, lethal dose 50%, test starvation, vaccine potency test. These are the some of the methods when animals suffer a lot to minor, moderate and severe while performing the animal studies. The alternative methods to animal testing are to be development and the implementations of the test methods that avoid of the live animals or the use of less animals in methods. So, we can use any alternative methods when there is no use of animals, or when we are using the thousands of animals, we can use the hundred of animals. The Council directive protections of animals used for the experiments and scientific purpose in Article 23. The Article 23 direct us use the minimum number of animals for any experimentations, and it should be judicious use of the animals. The Commission and the member states should encourage the research into development and the validations of alternative methods which could provide the same level of informations as that obtained in experiment using the animals, but which involves the less animals. But using the for example, we are using the 100 animals, the same 100 animals can be reduced to 50 animals or the 30 animals, as we are performing the same assays, same chemical tests, same radiological tests, so we can avoid the large numbers of animals. Normally we use 5 R's principle for the using the animals experimentation. First is reduce, reducing the number of animals. Refine, extracting the more data from the less number of animals. Replace, using the alternative methods than the animals. These are the three main R for alternative methods. Apart from is 2R is the responsibility of individuals of the scientist who will perform the animal study. The 3R principles were defined in 1959 by the W.M.S. Russell and R.L. Bush. They provide a strategy for rational and stepwise approach to minimizing the animal's use and suffering in experiments without compromising the quality and the quantity of scientific work being undertaken. Reuse and rehabilitate. Once the animals study is conducted, is completed, so we can use those animals by two ways. First is rehabilitate for sometimes, feeding the animals for 6 months, for 9 months, so that the excretions, through the excretion process, mostly drug is excreted from the body, and we are taking care of their health. And after taking care, when the animals become very healthy or reach to their normal health, we can use these animals under the reuse process. The fourth and fifth are, that's why is stand for the reuse and rehabilitate. And the responsibility to the individuals who is performing the activity. Needs for the alternative methods. What is the need of the alternative methods? Why do we need? First is because in laboratory animals may be poisoned, deprived of the food, water and sleep, applied with the skin and eye irritants, subjected to psychological stress bear by the animals, deliberately infected with infected disease, like in case of tuberculosis, is communicated to one animal to another animal, and sometimes the whole group of animals, whole species, and sometimes the whole animal house is also infected by the tuberculosis. Economic and efficiencies. The alternative methods is helping to bring economic and efficiency of the process. Another, now what are the ways how we can use the alternative method? First is the computer based technology. Second is the in vitro methods. These two methods are most commonly used for conducting for avoiding the animal studies. Now, let's take one by one. The in vitro. In vitro testing human cell lines have been useful in securing the relevant information for human risk assessment, thereby opening up the opportunities to explore the responses to existing and emerging therapies. Human cell lines can be used for the tumor and some other chronic disease. Now, we are not using animals. What we are doing? We are using the human cell lines. Human cell line means the human cells. We are extracting the some cells of the humans, and within the 96 well plate or within the Petri plate, we are using these cells and incubated with some media, and after incubating, after growing, we are giving our treatment, and in this method we can calculate the IC50. IC50 is the inhibitory concentration, the dose at which the 50% of the cells is dying. So this method is also very prevalent while conducting the study. Alternative techniques The term alternative is used to refer to those techniques or methods that replace the use of the laboratory animals. The field of alternative technique, particularly in vitro toxicology, has evolved into a respected discipline and is attracting competent and motivated scientists around the world. This picture is representing the different models than animals, how we can avoid the animals. Is describing this is describing pictures of non-animal experimentation. The in vitro, in silico, the culture technique, these are the four methods we can avoid the animal experimentations. Now, the use of computer in drug development. Everybody is using computer and we have a number of softwares developed for the different purposes. Right now in the studio we are using computer. So we developed such kind of softwares, such kinds of models in that we mimic the same activity as we do in the animals. In silico. First the word is in silico. Why this is called the in silico? As all the work is done in computer and the computer mostly is made by the silica, that's why this process is known the in silico studies. In this what we do, we develop some receptors that is already present in the human body structure and the chemical structures of the drug or toxins. Now we use some applications like CAD, computer aided molecular drug design. These are the software. The computer assisted learning CAL, microfluidic chips, quantitative structural activity relationship, organ on chips, computer of mathematic analysis. These are the some software and the applications. In this they have the database of their receptors, that is the PDB IDs are already available, and using these methods we can bind the receptors and the drug molecule, and after binding, after interacting these drugs, they will come out some score, and this score is commonly known as a docking score. Docking score is an end product based on their energies they yield during the interactions, during the reactions. That's why the docking score is a hallmark and a significant value while performing the in vitro studies. If the docking score is more than high, it means it has a high value and we can go for further studies in vitro and for further studies. Now, using the 3R principles, the methods of refinement for the animal study. Refinement means for control group we are using only for control group can be divide the positive and negative. We use the positive control group for others study also, as there is no disease to them. They are providing the relief, pain and distress by giving the drugs like analgesics, anesthetics and tranquilizers and sedatives. By changing the procedures, we can adopt some procedures that we can give the less pain and distress to the animals. And apart from it, the importance of skilled persons. The expertise of the skilled persons is essentials while dealing with the animals, as expert veterinarian and expert scientists while handling the animals. They should know pain and no stress while handling the animals. Method of reductions. Good planning of studies, change in experimental designs that is validated and approved by the ethics committee. Improve methods of data analysis. We should use novel data analysis so that we can find our analysis on less data or with authenticity. Sharing research animals. We should not perform the repetitive and repeated animal studies for the same molecule, for the same compound. If any study is conducted, so we should seek the data from the that lab, or we should concern the concerned scientists, concerned lab, or concerned country, so that the exchange of data can be done, and we can gather the informations at a very good pace and reduce the number of animals. Redesigning the studies to collect as much information as possible. First try to get the psychological or behavioral studies, so there is no harm to the animals, or the less harm and less killing of animals for the psychomotor activities, for behavioral studies. And basic principle is the share the information with other scientists, with other labs. So this is one of the good methods for reducing the number of animals. Replacement. How we can replace the animals? Replacement the higher animals with the lower animals. Why? The lower animals have a good breeding system, have a high rate of breeding, and can be produced in a shorter durations. Replace the live animals with the dummies for teaching and dissections purpose. In for a teaching purpose, we can use some dummies, and in today's world we have a computer based technology. We have a very good three-dimensional models. They can demonstrate a good physiology and anatomy than the animals dissections. Absolute replacement, no need to use animals. Examples, the cell lines. Different cell lines we have for human cell lines, for gastrointestinal cancers, NS126, A549 for lung cancer. We have a different kinds of cell lines that can be used for studying the cell studies, for cancer and for drug studies. Relative replacement, human killing of animals. Human killing is killing the animals with less pain to provide the cells of tissues for in vitro studies. The substitutions of insentient materials in place of the conscious higher animals. In vitro so these are the some methods that we can use for avoiding the animals killings. The 3 R's: reuse, replacement, and refinement. These are the alternative methods for, and using the alternative methods for the animal toxicity, using the in vitro methods and the in silico methods, and using the QSAR, so that we can avoid animals killing, and we can extract more data, and we can protect the environment. Thank you.